Hello everyone. I want to talk about how CYP, the cytochrome 450 metabolisms affect psychiatric prescribing. Cytochrome P450, commonly known as CYP450, are a superfamily of proteins which take part in the synthesis and metabolism of various cellular components. They are enzymes that are present in many organisms, including viruses, humans, plants, bacteria, and animals. They play various roles, but one of the most studied roles is their function in drug metabolism. These enzymes metabolize a wide range of drugs, including antidepressants, antipsychotics, mood stabilizers, and anxiolytics. Several CYP450 enzymes are very significant in psychiatry, including CYP2D6, CYP3A4, CYP1A2, CYP2C19, and CYP2C9. Understanding the role of CYP450 enzymes in mental health treatment is critical for successful medication interaction management. In clinical practice, these enzymes have a direct effect on the metabolism of various psychiatric medicines because they influence plasma concentration and overall treatment outcomes. For example, some patient reactions to antidepressants or antipsychotics may be changed due to the enzyme inhibition or induction, resulting in surprisingly low efficacy or increased side effects. Hence, prescriptions. The relationship between drugs, psychiatric drugs, and CYP450 enzymes is two ways. These enzymes can biotransform these drugs, or psychiatric drugs can inhibit, induce, or enhance these enzymes. When psychiatric drugs are ingested, the CYP450 enzymes help break them down into metabolites that can be removed. The rate at which this occurs affects the concentration of the medication in the blood. If metabolism is too slow, the concentration of the medication levels may rise, raising the likelihood of adverse effect and toxicity. On the other hand, if metabolism is too fast, drug levels may drop too low, limiting therapeutic efficacy. Individual genetic differences have a significant influence on the activity of CYP450. Genetic variants in CYP genes can cause difference in activity of enzymes among individuals. This variation affects drug metabolism, efficacy, and safety. For example, the CYP2D6 genes has polymorphisms that cause different metabolism phenotypes, including poor, moderated, extended, and ultra-rapid. Patients with poor metabolism phenotypes may have higher medication concentration and higher risk of side effects, whereas ultra-rapid metabolisms may have decreased treatment efficacy. This genetic diversity has significant consequences for personalized medicines. Drugs can either inhibit or induce cytochrome P450 enzymes, resulting in clinically significant drug-drug interaction that can lead to unexpected adverse responses or therapeutic failure. For example, interaction between warfarin, antidepressant, antiepileptic medication, and statin frequently involve the cytochrome P450 enzymes. At the same time, smoking is a well-known CYP1A2 inducer that can lower blood levels of some antipsychotics, including clozapine and olanzapine. If a patient abruptly stops smoking, drug levels may rise unexpectedly, requiring readjustment of the dose. Understanding the CYP450 methodologies helps medical professionals to make more informed decisions about medicine selections, dose, and monitoring. Although these tests cannot replace clinical judgment, they can provide useful information when patients encounter unusual side effects, poor treatment response, or multiple medication failures. Understanding the most essential medication preceded by cytochrome P450 enzymes, as well as the most strong inhibitors and inducers, can help reduce the risk of adverse drugs, reactions, and interactions. Although genotyping tests can establish if a patient has a specific enzyme variation, it is unclear whether widespread use of these tests will enhance results. Thank you so much. Until here, have a nice day. Bye bye.